Stefan Anker and Mike Gibson coming to you live from ESC 2024, and we're talking about the RESHAPE-2 trial, a trial of a new therapy in patients with moderate to severe heart failure. Stefan, talk to us a little bit about what you did.
Well, thanks so much for having me. Well, we are investigating the use of the MitraClip device. So that actually in itself may not be too new, because for the last 5-6 years, we know from previous studies that this treatment works in severe functional mitral regurgitation for heart failure patients and improves outcomes there, particularly the co-op study has shown this. But we are extending this now to patients with moderate severity of FMR and moderate to severe, kind of intermediate FMR as well. And now we recruited more than 500 patients, randomized them in this range of severity, and basically found that benefits are there regardless of the degree of functional MR. And these benefits extend to event reductions, so less heart failure hospitalizations, first and recurrent events, more than 40% reduction there, highly significant. Then when you do this analysis together with cardiovascular death, also very similarly a significant reduction, 36%. And the third primary endpoint was quality of life, because we not only want to reduce events, but also improve the symptom status of patients. A very strong 11-point difference. So in the KCCQ overall summary score, so the patients receiving the device treatment, 21.5 points, and those in the control group only 8 points improvement. So really benefits all around for event reductions and also for quality of life and symptom improvement.
So adding years to people's lives and adding life to those years they have. Stefan, what's going to be next for the Mitral Club?
I think that there will be a big discussion how the thresholds from when you should start actually considering the therapies should be changed in light of these results. Whether or not this will lead to guideline changes, I can't predict, but personally, of course, I would hope. And I think there will be simply more patients receiving this now with more certainty. With this study, we have extended the evidence that this is a useful approach for treatment to the patients with a, shall we say, less than severe functional MR.
Great. Well, thanks, Stefan. Thanks for joining us today. And thanks to all of you for joining us here live from ESC 2024.